body weight step up. We're essentially mimicking walking upstairs. If you do not have a step, you can utilize your staircase. You can use the cement step outside. Find something that you can, some books you can stack, something that mimics that step up sensation. So I'm placing my foot on the bench. I want to make sure I don't get pinchiness in the front of the hip, to choose a height that works for you. The big difference here is I want you to think about pulling yourself up versus pushing off this back leg. So the front leg is the one that is working. I'm thinking about staying heavy in my, in this case, left heel. I'm essentially pulling myself up, dragging on the heel as I come up to my step up. If you want, you can set up your bench in front of a wall or just something that you can kind of hold on to with the opposite hand. So if you feel a little wobbly, you can hold on to it as you step up. So once again, we're thinking about pulling ourselves up onto the bench. So I'm going to think about sending my butt back. I want to maintain this rib cage pelvis connection. So when I go into my step up, I don't want to flare my ribs, because then I'm going to feel this a lot in my low back. I may feel more just in the quad, but we really want to feel that glute. A step up is really great for the glute. So when I'm setting up in this step up, I'm going to think about sending my butt back, watching that flaring my ribs, so keeping that connection, getting heavy in this heel, and I'm going to pull myself up to stand and then lower myself down. So pull with that working leg, and then a controlled lower. So this is your body weight step up. This case is my right foot. I'm going to pull myself up and just tap this opposite foot onto the bench, and then slow lower. So a couple things we want to watch out for is that we're not just pushing ourselves up with the back foot, and then as we come down, we don't and fall back. So I want to maintain control. Once again, you can hold on to something in front of you as you come up, and then lower back down. Come up and lower back down. All the while we're keeping this booty open, and we're watching we don't flare through the ribs.